Dodd, Senior Director for the System-Wide Special Pathogens Programs for New York City Health and Hospitals. Thank you for this exclusive interview for Digi24 Romania.
Thank you for having me.
You were involved in preparation of responses to various epidemics over the last years, Ebola and Zika viruses being just two of them. What is different in the case of SARS-CoV-2 because it leads to a pandemic instead of just epidemic?
Yeah, so, I've responded to multiple pandemics and epidemics throughout, my career. And what makes COVID-19 so different and so difficult is first, you're dealing with a respiratory virus. And there was a lot of mistakes that were made early on here, for example, in the United States and even across the world, of first underestimating the disease in and of itself and not having the infrastructure that we all needed to be able to respond appropriately and rapidly to this contagion. And so there was a lot of issues that, this pandemic has faced early on, and it continues to face even 8-9 months into this pandemic. So if the political and the politicians don't take this seriously, if they don't have the political will and the backing, then you're going to have, a worse outcome. And here in the United States, you're seeing that not only are we playing this from the public health standpoint, you're also seeing politics also take center stage. That is unfortunately making the situation a lot worse.
A bunch of world leaders, including the President of the United States, Donald Trump, treated this knowledge about this virus as a hoax or as a flu, as they often mention it. How did this affect the impact of the pandemic over the entire population of the world and, of course, in the case of the United States?
When you deny the data, when you deny the facts, when you underplay the information that you have, when you alter the data, when you're doing any of these types of factors that contribute to misinformation and disinformation, it only propagates the pandemic. It makes the pandemic much worse. It increases illness, it increases the number of cases, and it increases the number of deaths. Here in the United States, we were behind, at every crucial moment in this pandemic because we underplayed the facts and we didn't have the infrastructure that we needed to be able to respond appropriately.
This virus especially was created, it's a human creation, it's created in a laboratory, or is a nature creation?
Based on the data that we have, there is no indication that COVID-19 or SARS-CoV-2 was created in a lab. All of the evidence right now points to this being, a natural phenomena, and it's not surprising, right? So people often think, well, how can it have such a huge impact and it, come out of nature? And that's really the case of it. We have plenty of examples, if you look in the past, where, these are just natural phenomena that happen that obviously can get out of hand and cause, a pandemic, if you will.
New York City's population is almost as big as the entire population of Romania, and I'm sure that in the case of New York, and not only New York, but the entire United States, we can see, as we can see in Romania, people being skeptical about the presence of this virus. We have a lot of conspiracy theories. Why do you think it's so hard for people to understand that it's a situation that is actually very important about their health?
I think one of the biggest issues is first the poor risk communication that's happening at all levels. If you don't communicate to the public in terms and facts to the way that they can understand, then they won't apply the behavioral measures that are needed to help stop the spread of COVID-19. On top of that, help protect themselves and their community and those around them. So one of the biggest things is we're doing a very poor job when it comes to risk communication. The second issue is there's a lot of misinformation and disinformation that's out there. And we saw this very early on. As soon as the outbreak started in China, you're seeing some of these social media channels like Facebook and Twitter, and a number of these other different platforms that started to have conspiracy theories. People started believing, things that were not true. And so, in all of my years, as I mentioned, in responding to epidemics, you always respond to two epidemics at the same time. You're responding to the contagion itself, and then you're responding to the contagion of misinformation. And both of them go hand in hand. And unfortunately, the contagion of misinformation in COVID-19 is much, much more prominent, and people are much more influenced by misinformation, disinformation, which unfortunately puts them at higher risk, and then they deny what is actually happening.
We have a news coming from the World Health Organization saying that the number of infections is actually going up, but the number of the dead people is actually going down. Is this a good news, or how shall we see it?
You know, there's a lot that we've learned about COVID-19 since it started, you know, back in December and January. And one of the things that we can do, that we're doing better at in terms of death, is we have better treatments available, right? And this is not to say that we have a golden standard treatment or a silver bullet, but we have anti-inflammatories. So our treatment for hospitalizations, or those that are being admitted and hospitalized, has definitely increased. So we're able to decrease the number of people dying from COVID-19 because of some of the treatment options available, and because we've learned more about how to intervene earlier and do things better. But at the same time, you're also seeing people that the shift in the demographics. So more of the younger population is getting infected than the older population. And what we know about COVID-19 is the risk of death and the risk of a severe outcome increases with the risk of age. And so for the young or the youth that are getting infected, and that's where you're seeing, you know, a number of surging cases, you're seeing the death obviously continue to decline, which is great. But again, as I've mentioned, we don't know the long-term ramifications. We don't know the overall sequelae, you know, associated with COVID-19. So even if the youth don't die from COVID-19, they may have long-term issues that we're yet to find out. The risk of spreading COVID-19 is 20 times higher indoors versus outdoors. So there are things you can do that can lower your risk of not only spreading COVID-19, but also contracting COVID-19.
In your opinion, as a specialist, when is possible to have this vaccine?
I think that we can potentially see a vaccine available by end of this year. Not to say it's going to be available in October or November, but perhaps sometime end of this year. But it won't actually be available to the general public until 2021, right? So the first group that's actually going to get the vaccine are going to be the priority groups, like first responders, healthcare workers, those that are at higher risk of having a worse outcome with COVID-19. Those are going to be the priority groups. But then the general public will then eventually get that vaccine sometime in 2021.